TachyTips!
Seizures. Did you know epilepsy and seizures aren't the same thing? Seizures are sudden changes in behavior that can be caused by an interruption or sudden surge in electrical activity, in the normal electrical activity of the brain. While epilepsy, on the other hand, is a chronic neurological disorder that causes recurrent seizures. So, what causes seizures? Dehydration, sleep deprivation, alcohol use, drug abuse, or simply not taking your medications. And how about epilepsy? Epilepsy can be caused by trauma, by strokes, by birth defects, by infections. Also, there are many types of seizures, two large categories: partial seizures and generalized seizures. And in this video, we'll be focusing on generalized seizures, especially the ones that we always see in movies, shows, series, tonic-clonic seizures. If you should see someone actively seizing, what's the first thing you want to do? Firstly, you're going to want to make sure that area is safe for you. So no cars are passing, no snakes nearby, no plane coming down to crash into you or hurt you when you're giving first aid to this patient. Next, you're going to want to make sure nothing around the patient can cause her harm during a seizure. Something like a chair or table, and if they're present, simply move it out of the way. Then you're going to want to get down on your knees, and you're going to support that patient's head while they're having a seizure. That's it. You can also use something like a pillow, something soft like a pillow to support it. Now we just wait. Normally a seizure lasts between 2 to 3 minutes, but really, it depends on the individual.
Hey, what's wrong? Is she okay?
She's currently having a seizure.
Well, I got this spoon. We can stick it in the mouth so she doesn't clench on the tongue.
No, we don't want to introduce anything at all inside the patient's mouth during this time. Worse, your fingers. During an active seizure, they rarely bite their tongues, and if they do, it's minimal bleeding. So anything like spoons, forks, pens, sticks, nothing inside their mouths. Why? Because also they can clench down on it hard enough and break their teeth, causing them to choke.
Well, rumor has it that if you rest salt in the palm of the patient, they will ward the seizure off.
Also, no. We do not use salt to stop seizures. By the time the person leaves to get the salt, finds the salt, comes back, puts salt in both their hands, the seizure has already stopped. Why? Not because of salt, but because of time. And in Fiji, they use pepper on their foreheads. In Botswana, they use a coal rag over their eyes. Both things that don't help against seizures.
Well, do you think taking a shot could help her with the seizure as well?
No. Alcohol, beer, rum, anything of that nature do not help stopping a seizure. And about the evil spirits, well, I can't really talk about things I don't know about, but all I know is that we don't want bad vibes here.
Well, I could hold her down so that she doesn't seize out of control.
No! During an active seizure, we do not hold the patient down. We want them to seize. The only thing we're doing is protecting their heads. Just let the seizure happen.
Thank you, doctor.
So, when the convulsions have calmed down, the next thing you're going to want to do is you're going to put the patient on their left side. This is called a recovery position. The first thing you're going to want to do is you're going to take their left hand and put it at a 90-degree angle. Then you're going to take their right hand and put it under their opposite side of their chin. Then you're going to take behind the knee of the right leg, and with the right hand you're going to pull towards you, causing the patient to roll over. This leg supports this position. The left hand prevents rolling, and the right hand under the chin keeps the airway open. You can also put the patient to their sides during an active seizure, not exactly in a recovery position, if you notice an excess buildup of fluids inside their mouth, possibly blocking the way of breathing. Now, after you've put them in that recovery position, the only thing you're going to want to do is stay with them until they regain consciousness. Now, this might take a while, and when they start to come out of consciousness, they'll be very disoriented. And during this time, very, very rarely, they can be a little bit aggressive towards you. So you want to be careful, not take your face too close to them, just in case you don't want to get hit. And the last thing you want to do, the last thing you should know, is when should you call for help. If it's their first time having a seizure, call for help. If they had a seizure in a body of water, call for help. If the person is pregnant and or sick, you're going to want to call for help. And lastly, if after the seizure they remain unconscious, you're going to want to call for help. Great! Now, anytime someone has a seizure, you'll know what to do. First aid style. Man, we're really out here teaching you guys how to be superheroes. You know something else to save the day. And like always, they can't fool you if you don't know.